I'm Dr. Janet Yu, a physical therapist and pelvic floor specialist. So I'm going to talk about why people going through perimenopause and menopause have urinary leakage. So the biggest reason is muscle strength loss due to hormones. And so this is our bladder. This is the urethra. So that's part of the bladder that helps to control leakage. And it requires estrogen for it to be healthy and bulky and just have strength. We generally lose this muscle strength over time anyways. It actually starts in our 20s, but other things are strong enough to be able to not have leakage for the most part. But as we age and go into menopause, estrogen dips and this tissue actually becomes thinner and less bulky. So I drew this thing out. This is a cross section of the urethra, that muscle. So in the normal urethra, it's this muscle bulky part, and the center hole is where the urine would come out of. So notice this nice big muscle bulk. So when you contract, it helps to squeeze down this hole so you stop leakage. There's some tone to it so that you don't leak. And of course, this is like a very rudimentary drawing and explanation, but bear with me. This is a urethra that has low estrogen. The muscle is thinner, not as thick. And could you imagine this smaller amount of muscle trying to close the urethra? And so you don't get good closure. You end up with leakage when you have sneezing, coughing, any of this high pressure. It tries to close and it doesn't close all the way, and you have urine leaking through this area. So what pelvic floor muscle training can do is we can work on strengthening this muscle so it looks more like this. That can be more anteriorly deviated pelvic floor muscle strengthening, meaning when you do some Kegels, you can think about squeezing the front of your pelvic floor, thinking about lifting the bladder, slowing down or stopping the flow of urine is another one. I don't recommend doing that as an exercise unless you have some specific parameters, such as you stop the flow of urine on a full bladder. After you wait a few seconds, then you stop the flow of urine, and you count how many seconds it takes. It should be an immediate stop. If there's any delay, that means that this muscle has some type of weakness to it. So you can do that as an exercise, but again, you want to do it on a full bladder because you want to make sure that you maintain the reflex of the bladder stretching to the brain that signals the fact that you have to pee. So that's one way of improving urinary leakage and menopause. Another way is to add some topical estrogen to this area, or hormone replacement therapy. Those are things that we would help guide this conversation that you would have with your gynecologist about. So adding some type of topical estrogen can improve the muscle tissue quality and the tissue bulk back up to closer to more of this, so that when you do a pelvic floor muscle squeeze, or when you do have that high velocity stress like sneezing, coughing, jumping, when you squeeze, there's this bulkier muscle squeezing down on this inner part to close versus less of muscle tissue trying to squeeze and close down on the part where the urine comes out of. So those are the two ways that you can affect estrogen and muscle bulk when you're going through perimenopause and menopause.